Hello, everyone. Welcome back to the Mass Retirees Weekly Update. Today's Friday, May 30th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, of course, I'm joined today by a few special guests. First and foremost, our legislative liaison here at Mass Retirees, Nancy McGovern. We're also joined by folks from the Massachusetts Senior Medicare Patrol. As you may or may not know, next week is Medicare Fraud Prevention Week. So we thought that this would be a wonderful opportunity to bring on some experts in terms of protecting retirees from Medicare fraud and overpayments that sometimes occur with your healthcare plans. So we are thrilled that we have two representatives of the Senior Medicare Patrol here in Massachusetts joining us. First and foremost, Lucilia Prates-Ramos, the state director for the program, along with Lori Laviolette. I'm sorry, Lori, if I mispronounced that. But we
Okay.
are thrilled that both of them have taken the time out of their busy schedules leading up to Medicare Fraud Prevention Week to join us. I'm not sure which of you wants to kick off, but if you could just provide a little bit of a synopsis of who the organization is, the work you do, and we'll go from there.
Okay. Sure. I'll start us off. My name is Lucilia Prates-Ramos, and I'm the director for the Massachusetts Senior Medicare Patrol program. And we are a program that's funded by the Administration for Community Living, Department of Health and Human Services. And the mission of our program is to reach, educate, and counsel Medicare, Medicaid beneficiaries on preventing, detecting, and reporting healthcare errors, fraud, and abuse. And so, as stated previously, next week marks the Medicare Fraud Prevention Week, and it is a national it's been designated as a National Observance Week of Medicare Fraud. And what we do is we really try to reach and educate Medicare beneficiaries and their family members on how every one of us can have an active role in preventing Medicare fraud. Medicare fraud is costing American taxpayers billions of dollars. The figure we use is over 60 billion. And I can tell you that that number is probably a conservative number. I have been using that number for almost 2 decades. So, and given the number of calls and the fraud complaints that are coming in to our program and across the country, I would venture to guess, and it's an educated guess on my part, that that number is much higher.
Well, what are the consequences of 60 billion, even if that is the number, and I agree it's most likely a very conservative number. But what are the consequences for retirees?
Well, imagine what we could do with that money, right? If it wasn't going into fraud, what other services could be made available to people? But as far as consequences are concerned, Medicare fraud impacts us all, not only financially, but it compromises one's medical identity, uh, compromises their Medicare number, and oftentimes people are being sent items by different entities, durable medical equipment companies that individuals have no need for. And if they were to need it, and within the next 5 years, Medicare may not pay for it because they've already issued a
Okay.
brace, or that maybe they've, diabetic supplies. We see all sorts of medical equipment being sent out to beneficiaries across the state where they have not, it hasn't even been prescribed for them.
Well, let me turn it over to Nancy for some follow-up questions.
So, what are some of the reasons do you think that, older adults are so vulnerable to the Medicare fraud and to the, just the random, like you gave the example of the durable medical equipment and why they just send them out and why they're always a target?
Well, I think that they are, I think that these people who are calling them are extremely clever. They use fear tactics about your Medicare benefits are going to end. Medicare is issuing a new card. Medicare is now issuing a new card, and they are. We're doing we're calling you because we want to do follow up with you to make sure that you are who you are and your number. And we want to confirm your number. They're very savvy at what they do. And so it's easy for people to fall into, um, and to give them this information. It's very easy for them to fall for whatever they're asking them for. I spoke to a beneficiary just this morning who is absolutely distraught over the fact that her Medicare number has been compromised. She's receiving medical equipment, namely braces for every joint in her body, and she can't stop them from coming. And they're coming from different companies. So some of these companies are phantom companies where they set up shop for 3 months and then they move on to the next to another state and they set up again and they use the same number, the same beneficiary number, or they sell it to someone else. And it's wreaking havoc in people's lives. So for caregivers who may listen to this video, I would like to say to them, please be more attentive. Ask parents, family members, older folks who may be Medicare beneficiaries and receiving um, these kinds of boxes with braces, intermittent urinary catheters, diabetic supplies, all sorts of things, creams. And please, treat them like they didn't commit the crime. Somebody else is committing that, because oftentimes beneficiaries feel like I've done something wrong. And that's not the case. 9 times out of 10, that's not the case.
Okay. So what should beneficiaries and caregivers be monitoring to help prevent that?
They should be monitoring their Medicare Summary Notices and their explanation of benefits and any other health billing statements that they may receive, right? Because that is key. Those three tools are really key because they will see, whoa, wait a minute, I don't understand why I'm being billed for this. Um, and then they should definitely reach out to us. Call the Senior Medicare Patrol program, call Medicare, report it to the OIG. And we're here to help people and we'll help guide you through this.
And we
So
will be, in addition to having this information in our weekly message, we will add it to massretirees.com, our website, as well as on our social media platforms, to give retirees an easy ability to contact you or to contact Medicare. Where should they start? Should they call the you folks first, or Medicare, or both?
They can do both, or either or. Oftentimes Medicare will say call your local SMP program,
Okay.
so that they can do that. We also encourage people to use a personal healthcare journal, which is called My Healthcare Tracker. And I think Laurie can speak a little bit more about our outreach efforts and the tools that we use to really empower people to take a stance.
Yeah, of course. So a big focus of our presentation and our education efforts revolves around the personal healthcare tracker that Lucilia was mentioning. It's a tool that we encourage people to use to keep track of their records and their visits to their healthcare provider, so that once their MSNs come in, or if they go to their portal and they compare their MSN with their healthcare tracker to ensure that the appropriate services were not only being billed for, but were actually rendered, and to really double check and cross-reference any items that may have been prescribed by your physician or not, as is the case with a lot of the durable medical equipment. So we really, really try and educate the public on how to use the tracker and the importance of the diligence in becoming an informed healthcare consumer. It really, the effort is really on part of the beneficiary, being diligent and being concerned and aware of their practices. So we spend a great deal of time going to different senior centers in the Commonwealth to extol this message. We do tabling events throughout the Commonwealth to enlighten as many beneficiaries as we can. So that's my role in the program. So,
And what are some of the encounters that folks should be really writing down and recording as they kind of go through their medical journey, right? I mean, we all do our physical kind of every year. You know, is that something, or what do those encounters look like for folks?
Yeah, so we encourage people to write down any and all encounters that they have with their medical providers, including telehealth encounters as well. So anytime they are receiving services from a healthcare provider, we encourage them to write that service down, so that when their MSNs come in, they can say, "Oh yeah, I did see Dr. So-and-so for 30 minutes, and we did discuss diabetic supplies," or we didn't, or just to keep a record of the experience.
Do home health staff, like VNA staff, home health aides, do those folks fall under those parameters as well? We know that folks have services in home and people coming in and out. So are those under that as well?
Yes.
In terms of, yeah, okay.
So I would say, I'm just going to reiterate what Laurie said, is that all healthcare encounters are important to really record and to keep in, some kind of chronological account, and what happens during that visit, and what happened during that hospitalization. Was I there very long? Now, I know that when people are in crisis, it's hard to keep track of all of these things. That's why caregivers are so important to be part of this equation, because it's really difficult to navigate the healthcare system when on a good day, right?
Yeah.
But if you're sick, it's more difficult. And so we really encourage people to prepare for their visits. We in fact have 5 questions in our journals that have been adopted from the Choosing Wisely campaign that the ABIM Foundation funded. And so, do I really need this procedure? What are the risks and side effects? What's a simpler way to treat this? Very simple questions to be able to ask your one's physician. Also to keep an updated list of all of their medications, and to take this healthcare tracker with them when they're traveling, because, God forbid you forget a medication at home and you don't know exactly what medication what the dosage is, what the name of the medication is. You've got all that information right there, where you could pick up the phone and call your doctor and say, I'm out in California and I left my meds at home, and it just facilitates things. And I think it takes the angst off people in many ways, the panic. And we hear a lot of panicked voices on the phone because they feel like, I was just defrauded. I don't know what's going to happen. I just confirmed my Medicare number. I just confirmed my doctor's name. What are they going to do with this information? And anything can happen. There's a health quality aspect to this as well that people really need to be attentive to.
I think your comment about traveling and carrying it with you is really important. I know that we have a lot of members who spend a period of time here in Massachusetts and a period of time in another state during the winter. And so really being able to kind of keep track of that as they're moving back and forth between residences and engaging with different medical providers in different areas, I think is in particular very important.
Yeah.
And I think also, in particular around home health aides and things, I don't know if you see it but folks don't want to report on, Jane who comes in every Monday and Wednesday to help out and things like that. But, do you see that those are kind of instances where people really should be keeping track of things like that?
People need to keep track of things like that. And if somebody is supposed to come in and they didn't come in, but they give you a timesheet to sign off on, you can't be doing that. You need to really understand that. If somebody was supposed to be there on a Friday and they don't show up on Fridays, then you cannot sign off on that Friday. You know, those things happen, unfortunately.
So I think just to be clear, so when we're talking about the explanation of benefits and some of the other forms, what we're referring to is, the letters you'll get in the mail. Usually at the top of it, it says, "This is not a bill,"
Yes.
and it details that medical visit or that medical claim. The date that it occurred, the doctor or medical providers that you visited with, at times the procedures that were done or durable medical equipment that was bought. And I would assume that the journal you're keeping is part of the purpose of that is so you can match up saying, okay, on May 28th, when we're filming this video, I saw, Dr. Smith and I had this done, versus getting that in the mail and saying, wait a minute, I never saw this provider, or at least I didn't see the provider at this time, and it was not for this procedure. Is that the general gist of it?
That's the general gist of it. And now, we treat things like an error. Complaints come into us, errors are made because typographical errors, I make them all the time, every day,
We all do. Yep.
right? And so then they're very easy to make, and one can be upcharged for something. I don't see those typographical errors being a downcharge. So there's something to be said about that. But so I say to people, treat it like an error, question everything you see, and call somebody about it. You know, you don't have to have all the answers, and we may not even have the answer for you, but we will do our best to research that answer and get it to you. And if it feels like, trust your gut. If it feels like something is wrong, it's probably wrong. Our gut speaks very loudly, right? And just check things out. Check things out and report it. It needs to be reported because otherwise we're never going to stop this cycle.
No, but I also think, it's important to emphasize, as you said, that not every case of an overpayment or overbilling is fraud. Mistakes
Yes,
are made. So we don't want to disparage, medical
anybody.
providers that
Yeah.
are doing the right thing, and an innocent mistake was made. But at the same time, we do know, as we said before, that there are bad actors out there, that their whole intention is to defraud retirees or anyone else that they can steal money from. That's what, at the end of the day, what they're trying to do. And, we need to do our part to try to prevent that from happening.
Right. And just to keep in mind that Medicare does not call you. Our government is not going to call you to give you anything or tell you that you're eligible for something. If somebody calls and says that you're eligible for something, or, there's a new benefit out there for you, just hang up. Don't even engage in conversation. This happens incessantly. I mean, Lori can attest to the fact that I get calls on my private office line, minimally 5 to 10 times a day. Somebody is trying to sell me something, some benefit. And it's just cold calling that's happening. So just hang up.
Yeah.
Can I ask, so if somebody does notice whether it's an intentional fraud or, an error, how should they go about approaching questioning what that record says, right? So, most of us feel that our healthcare provider is, we have this long-term relationship with them and they're the most knowledgeable and they understand it. And so questioning is sometimes hard for folks. And so how should people approach something that they see that concerns them. Do you have any tips for that for our
So
members?
I think people need to think about the fact that when they go to their healthcare provider, that healthcare provider is not the person doing that billing. It's somebody else.
Mhm.
It's another department. It's outsourced to an outside entity or a company. It's sometimes even out of state, right? So, and note that typographical error could have been done by the individual doing the billing. So, I think you need to start by calling the company and saying, whoever's doing the billing, who issued that invoice, and to ask, I got a bill here and I'm not sure what this is for. Can you clarify this for me? If they're not receptive to that, that's problematic. And so you might need some help in intervening. So and that happens often, I have to say, because there's a lot going on in billing departments. I'll share a quick example with you. I've been working on a case with two other people who are on my staff. One is a volunteer, one is a staff person. And we have been working on this case for months now to get somebody reimbursed for a double payment that was made by no fault of her own. She made her copay on 3 different visits. It was electronically deposited, each one of those visits, and then all 3 checks were deposited at a later date, like 3 months later, they were deposited. So these 3 visits, which should have been $135, right, they're now at $270. And we've managed to get one of those copays reimbursed to her, and we're still working on 2 others, a total of $90. So it's not easy to navigate because you're talking to a lot of different people, and every time yesterday I called and it was like I had to repeat the whole story all over again. And and it's very frustrating for our older consumers in particular, right? And I get it because it's frustrating for me. And I've been doing this for many years. So, I think I lost my train of thought because I went off on a rampage here, sharing a story. But and so all that to say, Nancy, people should feel comfortable calling and inquiring. You're not making an accusation, you're inquiring about something, right?
Yep.
And you have every right to inquire. And if the answer is not to your satisfaction, then you have every right to take steps and an obligation because this is your tax dollars, everyone's tax dollars, right?
Absolutely.
Could you talk a little bit about what happens once, if they do reach out to you, and you initiate a process, what happens then?
So, I'll give you a concrete example. Somebody calls, let's just say I'll use the example from today. This one woman called me, she's received braces in delivered to her. And she doesn't have a Medicare summary notice that reflects that yet because we're like in the middle of a quarter right now, or at the middle of the second quarter, almost at the end of it. And so I took down all of her information, her personal information. Where did this? In fact have the box so she could tell me the name of the entity that shipped it to her. We took down all that information. We put it into a national database that the Office of the Inspector General has access to, and we then and also the people who are working on this in our program. And we took down her Medicare number, her supplemental insurance, her address, her date of birth, some, demographic information. And that is now going to be submitted to the Administration for Community Living so they can look at it and then it'll be sent to the OIG. It's being submitted through them for the OIG because it's clearly this lady has received braces repeatedly, and it's clearly her number that keeps getting compromised because of whatever reason. Um, and she's very nervous about it, but that's what we do. We send everything off to the OIG. That looks like potential fraud. Anything that's an error, um, that's not outright, questionable fraud. We work with the beneficiary, we work with the entity, we work with the provider to try to figure out what's going on. Like the case I mentioned earlier about the overcharging this woman for her co-pays, right? It might end up being fraud. I'm not sure. But, again, we treat it as an error and we're dealing with it and we document everything in our database. So we have a little book written about this one already, this particular case. And at the end of the calendar year, the Office of the Inspector General lifts the report from our database, from each state's database, and looks at what kinds of trends are going on, what kinds of money are being lost or recouped. Um, is it any particular hospital? And then, that information is looked at very carefully by them. And we also see trends, so, we could potentially see, in Massachusetts, for example, we could potentially see a trend with hospital A or provider B, and we could certainly reach out to the Medicare contractor and say, you know what, we've been noticing this going on. So there are various levels of reporting that can happen. And if we see Medicaid being compromised in any way, Medicaid fraud or Medicaid abuses, we communicate that to the Office of the Attorney General, who handles Medicaid in our state.
Yep, I was just going to add that the Attorney General's office has for quite a while had its own Medicaid fraud unit.
Yes.
Is very proactive on these cases.
Yeah.
So it's good that
We
you
work
work in
closely.
concert.
Yeah, we work in concert with them.
So I think
And if they see sorry.
Go ahead. No, go ahead.
And if they see something on Medicare, on the Medicare end, they send it to us.
Okay.
That was going to be a question I was going to ask about how, we work very closely with our group insurance commission and some of the the plan carriers such as Blue Cross and Blue Shield and, WellPoint and whatnot. And how could we work with them to work with you around this issue to kind of be more proactive?
I'm a firm believer in people meeting and talking. So I think that one thing we might want to think about is just having an introductory meeting and to say, this is what we do. And to see if there's some way that we could work together or not.
Well, as luck would have it, we have Blue Cross and Blue Shield of Mass coming to our office tomorrow morning with their new Medicare director. So we'll be very happy to make the introduction.
Yeah, great.
So I think how else could we as an organization be helpful to your organization to educate members, in particular around, activities maybe next week and things that we could share with our members?
I think we should, and I think we discussed this, Nancy, earlier. I'm not sure that definitely to get our newsletter. People want to sign up for our newsletter, they should go to our website and sign up for our newsletter. Consumers, your constituents, they can go right into the masmp.org website and sign up for the newsletter, the Freudian slip. And it's informative. Also, we have many volunteer opportunities. I have to make my pitch here. If anybody is interested in volunteering with the SMP program, to please feel free to call us. We provide lots of support for our volunteers. We do a monthly training with them. I offer monthly foundations training. There's a meeting that we do, meeting/training, every 22nd of the month the 22nd falls on the weekend, then it's either the preceding Friday or proceeding Monday. And we're very supportive of our volunteers, so people are welcome. And I think that just getting, anything out to you, information about upcoming events, people should feel free to go on our website and look at our events page. We have a calendar of events, and there could be something possibly going on in your neighborhood. And I'm sort of stealing Lori Laviolette's thunder here. But
Oh,
if people would like to schedule an event for their church, for their, I don't know, book club, what have you. Kitchen table dialogues are really, really good for organizing. We need to organize around this fraud stuff
Yes.
and combat it. So call Lori. And Lori, give out your number. And
So yes, I can do that.
okay.
I can absolutely do that. So yes, for scheduling of events and the like of educational sessions, the number to dial would be 978-946-1278. So,
And once
I'd be
again,
happy
we
to
will
assist.
thank you for that. And once again, we will be providing all of this information in Friday's email blast that will go out to all Master
That's great.
Retirees members. 6 a.m. Friday morning, they'll get it. We'll also provide it on our website. This is an important issue, so whether you're a Mass Retirees member or not, we want to make sure that you have the information to protect yourself and that we can all do our part to, if not completely eliminate, at least reduce Medicare fraud as well as protecting retirees. They go hand in hand.
Absolutely. And hang up. Do not engage in dialogue.
Yep, whether it's from, regardless of who is calling you, if someone is asking you for your personal information, and as Lucilia said, that there's no one from the government is going to call you and ask you for that information. It just doesn't happen. So hang up the phone. If you get something in the mail, throw it in the garbage. When in doubt, you can call us. You can call other organizations to check. And we just want to make sure that you're protected and that everyone again is doing their part. So I think we've run a little bit over time, but this has been some great information. I can't thank you both enough for taking the time to spend with us this afternoon and get this information to our members. And I'm looking forward to collaborating as time goes on. So thank you again.
Thank you. Thank you,
Thank you.
Nancy,
Thank you.
for making that connection and making this possible. Thank you, Sean and
You're
Laurie.
welcome.
Thank you very much.
Bye.